I'm not hearing anything. Is something happening?
There we are.
All
Okay,
right.
good evening and welcome everybody to this inaugural Cambridge Community Conversation. It's a virtual meeting. And in a few moments, we'll be hearing from Dorchester's Health Officer, Roger Harrell, and Deputy Health Officer, Dr. Casey Scott, on the status of the COVID outbreak locally, as well as information related to the Stage 1 Roadmap to Recovery and Safer at Home advisory recommendations and regulations. So responding to community concerns and questions is what this is all about. And we want to thank Roger and Dr. Scott for making their time and expertise available for this conversation this evening, well outside of office hours, we might point out. You may post your questions in the chat sections of the Facebook and YouTube live links, and they will all be saved, and as many as possible will be answered later in the broadcast, just as many as time permits. Our thanks also to Angela Grove. She's the Public Information Officer for screening these questions with us here in the control room. A couple of housekeeping matters include thanking the Cambridge Association of Neighborhoods, the Dorchester banner, and of course, WHCP Radio, where I'm the general manager, for sponsoring this very first Cambridge Community Conversation. We've already received suggestions from the community for multiple additional topics, and have set next Wednesday evening at the same time for a school board candidates forum moderated and sponsored by the League of Women Voters for the District 1 contested primary on June the 2nd. With everyone's safety paramount, Dr. Casey is being connected from her home tonight. Roger is here with us at WHCP, but he's off in a separate studio. And we're using the large performance studio in the front for much more than 10-foot separation between Technical Director Doug Schutz and Health Department Public Information Officer Angela Grove. And so with that, I'll introduce Roger Harrell. And Roger, welcome to the broadcast.
Well, thank you, Mike. It's indeed an honor to be with you tonight. And it's even more great that I'm sitting here in what's known as Cambridge Matters Studio A, which is it's very important in terms of a partnership. And I say that very important to me. Let's talk just briefly about who we are. And Mike, you said we're here after hours, and that's true. The staff works hard at Dorchester County Health Department, but I'm on call 24/7, 7 days a week. It goes with the turf. That's what it's all about. Because what we do is we go from birth to death, from prevention to crisis intervention. We're working in partnership, and I emphasize the word partnership with the community to assure a safer and a healthier place for our citizens and to raise a family, to work and play. And partnerships is what's making this COVID intervention very important to us. A little history, we go back to Public Health 101. And what's this about? When you don't have a vaccine, which we do not have for this COVID virus, we do not have a solid treatment at this point. We go back to the simple things, and that is testing folks, and when they are positive, contact tracing those folks, isolating them away from the rest of the population while they're in recovery. And then we go to the next level. And in order to do that going in, since we didn't have a lot of testing, the governor went to a stay-at-home order, which is one of the best methodologies you can have in terms of flattening the curve. It's the social distancing, having you go out when you only absolutely have to go out for food shopping, for the necessities of life. What it threw on us, and my role, and Dr. Scott will tell you more about the clinical side of this, but for my role, it became working with my partners, working with the state's attorney, working with Bill Christopher, the executive director of our Chamber of Commerce, working with law enforcement, both the sheriff and the local chiefs of police in Cambridge and up in Harrell, working with the businesses, the ones that were essential to be working. We needed to make sure that work environment was safe for their employees, that they were questioning the employees when they come to work, that they were checking their temperatures, they were seeing if they were healthy. If they were not healthy, sending them home with pay. Those were the things that I worked with, and it was my partners that helped us work with these businesses to put in place social distancing, working into the plants, seeing that they're separating folks. They got plenty of hand washing stations. And that was before we actually got to the face covers, but making sure the environment was safe. So that was the front end. And then as we began to move into this next phase, which we're in now, where we lifted the stay-at-home order, we opened the other retail businesses, and of course that's another level of where these three partners that I talk about, the state's attorney, the Chamber of Commerce, and my law enforcement partners, working together and working with a team and getting messages out, but making sure that when folks come out and they go to shop, that they know they're going into an environment that is safe, and is safe for the shoppers as well as it's safe for the employees of there. So that's just a nutshell, a little bit of things that we do administratively. The real aspects of this, when it comes to the treatment and really telling you what it's all about clinically, is Dr. Casey Scott. We're blessed to have Dr. Scott. She was born and raised in Cambridge, great representative of our community. And I was so blessed a number of years ago when we were able to bring her into the health department. And I'm glad I have her now with this particular event, because her clinical expertise is valued very much. So I'm going to toss it over to Casey, as I refer to her, and ask her to chime in and tell you some things. And once we finish that, we'll go into our question and answer. Casey, it's all up to you.
Thank you, Roger. And thank you, Mike, and to our sponsors for having us tonight. I think one of the things that, we knew before this pandemic, but that's become just so apparent during this pandemic, is the importance of getting clear messages to our public. And this is just one of the many ways that we can do that. So thank you for that opportunity. So from the beginning of this whole thing, things have changed so much. And I think that's why it's important to keep an open dialogue. Initially, testing was so limited, and not just because we were limited with the number of test kits that anyone could acquire, but our labs were really limited in the number of tests they could put through in a single day. And so that led to some decisions such as the stay-at-home order and the closing of businesses, because that was the safest decision at the time. And so what we're doing at the health department is, as things become more available and test kits become more available, which the good news is that they are now, we're adjusting our response so that we can make sure that the public gets tested as they need. So in Dorchester County, most of the burden of testing was really placed, as it was in most surrounding counties, on our local healthcare providers, primary care physicians, our FQHC in town, Facet McGee, as well as our urgent care centers. And the good news is that seems to be shifting a little bit. So yeah, you can still get tested at your primary care office, and we encourage you to call them if you have symptoms, and they can help direct you through that process. But we heard of a new testing site that's going to be opening up as of Friday at Walmart. More information to come on that, but you can be tested there without a doctor's order. You just need to have a pre-registration that you fill out online. And us at the health department are working on some details on how we can expand testing as well to multiple sites around the county. So I think it's a message of hope, and I think it's good news that we finally reached a new phase in this, and that we're now able to expand our testing capacities. So keep it tuned in, and more to come on that.
Well, thank you both very much. I think at this point, we've got a number of questions that were fielded and sent in from the sponsoring organizations, and we'd like to go to some of those and send them out to Roger and Dr. Scott. We have one. There we go. This looks like one that maybe is meant for you, Roger.
Well, Casey just alluded to that. And when you say sites, actually, we had no specific sites other than we worked with our local clinicians, our local physicians, and nurse practitioners, offering them the opportunity to go up to have their patients either referred to us if they couldn't get up to the Chesapeake College, where we had a 3-day-a-week drive-in up there. I would call that a site. But we have worked on testing. We have tested some of our partners, our frontline healthcare workers or public safety workers. We tested those folks at the health department based upon the limited number of tests that we had. So a lot of testing has been going on. Those of you might realize, and I'll talk about it just a little bit, because one of the things I talked about was assuring that businesses were safe for the employees to work and trying to determine when they had an incident with a person that developed the COVID virus. One of those was and you might have read a lot about the chicken plant. And up in Hurlock, we have a great corporate partner that I've been working with personally with the president of the company and leadership since about 4 or 5 weeks now. And it culminated in testing last week where we tested over 11, I think it's close to 1,200 of their workers. And that was a heavy lift, but a great team of staff, Dr. Scott and the rest of my clinical staff. They did a super job over 2 days of doing that test. Now, that's a real testing site. What Dr. Scott's talking about is futuristically, we're going to do some other testing in the community. We talked a little bit about what's going on at Walmart. That's a partnership with HHS. If anybody looked at the national news right after this occurred, in early March, they stepped up and told the president that they would get involved with testing. And their whole goal now is to go to areas where you have under testing. And while we do have under testing, when I look at our numbers for testing, we've tested 5.1% of the population, which is one of the higher testing rates in the state of Maryland. 5.8, Wacomico is just a little bit ahead of us. So we've been doing some testing, and our positive rate is about 7.1%, which is much lower than the state testing rate, which is at 19.7%. So I'll toss it over to Casey to see if she has any other further comments about our testing sites and what we plan to do in the future.
Thanks, Roger. Yeah, so, in terms of testing sites, it's really been, like I said before, at the primary care physician offices, mostly because the encouragement was for testing to only be done on people who had symptoms. Right. And so it's very important for the people who had symptoms to get evaluated to make sure that they didn't need additional medical care. Now that the governor has changed the order and has made it a priority that people who without symptoms can be tested, that really gives us a lot more options. And so that's why our team is currently working on setting up health department sponsored testing sites. Again, details are still to be worked out. But keep in touch with us, keep in touch with our Facebook page. It's Dorchester County Health Department Emergency Preparedness, as well as our website, dorchesterhealth.org, where we will be posting some updates and more information as it is finalized. But we're looking forward to this opportunity to be able to expand testing to more than those people who are actually showing symptoms. It's important to remember, though, that when you get tested, that's really one snippet in time that you're getting your test result for. The risk still remains that you could become infected when you leave the test site and days later get your negative test back. So it's important to remember that just like I could take, your blood pressure today at this one moment and it's given one number, it's very similar to this COVID test. It doesn't mean that you still can't get it. It means that at the time you were tested, you tested negative.
All right, thanks so much. That clears up a lot, answers a number of questions that we've gotten so far. I think we've got another one here that has come in about precautions. Do we have that one? There we are. Roger, I think that looks like one that belongs to the director.
Well, I actually, if I would digress a little bit back to the testing question, and one of the greatest myths we had in the early part, because we didn't test anybody positive till late in March, was that, well, you must not be testing because you don't have any positive cases. And so Angela and Joint Information Center did a lot of work trying to convince the community, yes, we were testing, but because we didn't have a test site identified, I think that's why there was a mystique with the community. So there was always testing going on. But in terms of public transportation, we do have Dorchester Community Transit Services here, led by Santo Grande, a great friend of mine. And the best precaution on that is when you ride the bus, you need to be wearing a face cover when you're on the bus, and make sure that you're at least 6 foot apart from somebody on the bus. They clean those buses regularly after people have ridden those buses, which is a key part of that as well. And if you want to talk more about the cleaning aspects, we'll let Dr. Scott, I'll throw it to her for talking a little bit about cleaning and porous surfaces.
Thanks, Roger. So the CDC has listed on their website what they consider to be best cleaning products to use. But you'll see that there are also some homemade things that you can use in terms of like bleach solutions to disinfect surfaces. So it's important to, one, think about in your home or when you're out in public, the surfaces that are most touched by other people. Those are going to be the ones at highest risk of having viral particles on them. Important to remember, though, that although we do find virus on objects like, boxes, doorknobs, things like that, we still believe that the primary way that people get this from one another is through what we call respiratory droplets. So that's the little bit of liquid that comes out when you're talking, more of it obviously when you're coughing or sneezing, that can then travel through the air and land near someone. And that's really where that 6 feet of distance comes from. That's where that recommendation is from, so that those respiratory droplets have the chance to fall to the ground before they land on another person. There was a study done in mid-April that looked at how long you could find virus on different surfaces, and really it varies on the type of surface. It can last anywhere from hours to days. It does tend to last longer on surfaces like cardboard or stainless steel. So if you're trying to take the most precautions and lower your risk as much as possible, like an example for what I do when I go get my mail or an Amazon package from my front porch, I try to leave the boxes outside and dispose of them as quickly as possible. When I'm done handling that, I wash my hands really well. It's just all of these things that we're telling you to do, or that you're hearing the governor recommend, or the CDC. It's really to minimize risk. We realize that risk can't really ever be zero. And so we're just trying to strategize how we can reduce everyone's individual risk.
Now, am I correct that it sounds like you're being pretty cautious there with the Amazon boxes, since I didn't realize that it lived longer on cardboard. And
So-
we get a fair number of Amazon boxes at our house, but we typically wipe them down as well. Does that make sense, or is that an extra step that's really not necessary?
I think that makes sense. I think what's important to remember from that study as well is that they were testing for the presence of viral particles. They don't know how many of those viral particles are needed to cause infection. So when we look at these studies, they can say, yes, there's virus that can be on a surface for up to 3 days. Is it enough virus to get you sick? That's what we don't know.
Right. Okay. Well, thank you for the clarification. All right. We've got another question here that I think has come in about this is the time of year where a lot of us, like myself, get hay fever, feel like, oh my goodness, am I getting a cold or something? Or is it something else? There we go. Let's see. I guess this one probably belongs to you too, Dr. Scott.
Yes. Amen.
I will take it. No, please do not go immediately to the emergency room if you feel a cold coming on. So I think the thing to remember here is, would you go to the emergency room for these symptoms if there was no COVID-19? And if the answer is no, then no. And if the answer is yes, really take an inventory of your symptoms. So there are people who get very sick from this, people who have shortness of breath, people who need support with breathing, people who need to be admitted to the intensive care unit. Typically, those people have emergency type symptoms. And if there's ever a question, is this a serious enough symptom to go? Okay. But if you're feeling like you're coming down with something and you're concerned that it's COVID, but otherwise you would stay home and take care of those symptoms on your own, that's when we're asking you to call your healthcare provider. There's also some symptom checkers online. So the CDC has a symptom checker where you can go onto their website. They ask you certain risk factors. Do you have underlying medical conditions? They go through a checklist of symptoms that you have, and they can help direct you if you would benefit from getting a COVID test or not. We're trying to tell people to have, use an abundance of caution. So if you're feeling sick, but you don't know if you've been around anyone who has COVID, or, you don't have a known exposure, stay home if you're sick. That's pretty common advice, but in this day and time, it's important. Stay home if you're sick. If you have questions, if your symptoms remain, please call your healthcare provider. And if you don't have a healthcare provider, please call the health department and we can direct you what to do.
Okay, well, that's good to know that they can call you directly if they don't have a designated healthcare provider. I've also heard that Chop Tank Community Health would take people that didn't have health care otherwise and would get them the support that they need. We've got another question here. Yeah, what about people in special situations like this one, Dr. Scott?
Yes. So in pregnancy, there's no specific additional precautions to take. We still ask pregnant women to practice social distancing, remaining at home as much as possible, teleworking if possible. But I think it's really important to keep an open dialogue with your obstetrical provider, your OBGYN or midwife, and make sure that you are going or doing your, most of them I think are telehealth actually, keeping up with your prenatal visits. This virus doesn't, it affects everybody, right? So it can affect pregnant women, it can affect children. And I know it's making some changes for how deliveries are looking in the hospital and how OB visits are looking. But I think it's important that if you're pregnant and you're concerned or you start to develop symptoms, that you reach out to your OB provider for further guidance, because it's going to have to be on a case-to-case basis.
Thank you for that. I know that right now there's a lot of people that have been tested and have tested negative, or that have actually gone through the illness and been released after whatever the requisite number of days is. I think we've got a question here that deals with that, asking about someone who's had it and is recovered. I think that one also goes to you, Dr. Scott.
Amen.
Yes, I will take that one. So you may see on our daily counts, on our updates on our Facebook page, on the website, we talk about who is released from isolation or who has recovered. That really means that someone has gone through their active monitoring by the health department and they are released from their home isolation. So when someone tests positive, we receive that positive result and contact the patient. That patient is told to be on home isolation as long as they are stable enough to remain at home through their illness. So if they live in a house with other people, that means they really should try to find a separate space, a separate bathroom, as much separation as they can from the other people in the household to keep those other people from getting sick. And that isolation period lasts really, most of the time, it's anywhere from 10 to 14 days, but there are some very strict criteria for when people can come off of isolation. So they have to be fever-free for 72 hours, and they have to have a period of 10 days from the onset of their symptoms until their end of isolation. And so for most people, that's ending up around the 2-week period. At that time, when they're released from isolation, they're allowed to, follow social distancing just like everyone else. They may return to work. It's thought that they are not contagious at that point in time.
Haven't there been a couple of instances, or these rare outliers, where folks, I guess, have been released and then they actually suffered a recurrence? Or is that so rare that it's not really something we should pay much attention to other than anecdotally in the press?
So I think what you're referring to is when people are released from isolation and then they have another test that comes back positive. And that actually is just a function of the type of test that we do. So the way that we test for COVID is it's a test typically done with a throat swab or a nasal swab. And we are actually looking for the viral RNA. That's the genetic material of the virus. That genetic material can stay and linger in the body even though it's not active. So the virus is sort of done with its infectious period, but it still lingers in the body, which means we can still detect it using that particular method. So no, it doesn't necessarily mean that person got it again or that person is still contagious. It's a function of the type of test that we do to find the COVID. Thank
you for that. So we've got some folks with anxieties, some with anxiety simply because they may be an at-risk population. And I think there's folks asking about this question right here. Another one for Dr. Scott. Can you imagine that?
I'm on a roll.
Amen.
So, if this question had been asked of me earlier in the week or last week, I would have said, no, that's not currently how things work. But I'm happy to say that, yeah, you actually can now get a test, even if you don't have symptoms, even if you don't have a doctor's order. And that's thanks to our partners at Walmart. And also hopefully through our health department testing, which I said, plans are still in the works. And this is really because of the governor's directive. So, we really had to, in the beginning phase, follow what the state health lab was capable of doing, and also the number of test kits that we had available. But since the governor's procured a large number of test kits and our state lab now has the ability to run many of them a day, we can now expand our testing efforts to people who do want that peace of mind. But I think it's very important to remember that, again, it's a one-time test that you get, right? So it's only going to tell you information about that one point in time. And it doesn't mean that you're not at risk ongoing.
Do you know what the charge is? Is there a charge for if you go to the new Walmart testing station to get a test?
There is no charge.
Wow.
It's free.
Okay.
So you do, while we're on that topic, I want to just give a little bit more details about that. I know Walmart has posted some information on their Facebook page, and I believe they have some signage in the store. But you do need to register online for that, and it will walk you through it. You set up an account. That's how you get your results back at the end. But also it walks you through a questionnaire in terms of what symptoms and what risks you might have. And the website that you would go to is doineedacovid19test.com. So I'll say that again, doineedacovid19test.com. That is where you can look for that online registration for the Cambridge Walmart Testing Center. We'll make sure to post that on our Facebook page as well. But I just wanted to make sure people knew it's not a drive up and just get a test. You do have to go through a registration process, but you don't need a doctor's order.
Okay, great. Thank you for that practical information on how this is going to be working. I had heard a number of folks here back during the winter that had come down with some severe flu, and I think we've got a question on that topic as well, asking about. Oh, okay.
Yeah, that's
let's,
it.
Let's take let's take this one about the antibodies then. How about that? That's one that a lot of people have said, there was this nasty flu that went around. Can I go get tested to see if I actually had COVID? So I guess that's what this question is about. That's another one for you, Dr. Scott.
It is. And I see there's some people chiming in with some similar questions about the antibody test. So I hope I can address all of it in one snippet here. So let's start from the beginning. So the COVID-19 test, the throat swab or the nose swab, is the test that looks for the virus genetic material. And that's a test to see if you currently have COVID-19. When people ask about the antibody test, that is a blood test that is done to determine if you have antibodies to COVID-19, which means that you've been exposed to it in the past. Okay. These tests are available. Okay. Many different labs are putting them out, but there's a few issues with them, and that's why they're not really widespread available just yet. Number one, the reliability of these tests to actually find the antibodies in your blood. So we want to make sure that whatever test we're recommending that people get is a good test. So if we're looking for antibodies and we know that someone has antibodies, the test should be able to detect those antibodies. And all of these different tests have a different what we call sensitivity or specificity. And that's, doctor speak for how good the test is. So there's a little bit of variation across the board in these tests, and they're sort of ongoing FDA approval at this point. Number two, once we find an antibody to COVID-19 in your blood, what does that even mean? And that's really a question that no one can answer yet. The CDC doesn't have good guidance on that, and the Maryland Department of Health doesn't have good guidance on that. So there are viruses that you can be exposed to One is HIV. So you can be exposed to HIV and develop HIV antibodies, but you are not immune to HIV just because you have HIV antibodies. We don't yet know what the presence of COVID antibodies means. We hope that it means that you're immune. But if you are immune, we then don't know how long that immunity might last. Is it good for a couple of weeks? Is it good for life? Is it good for a few months? And that is what is being studied right now. So that's the information that we just don't know yet. This is the latest scientific, the word that I've heard. And I think we're all sort of patiently awaiting this information because we do think it will be useful, especially looking towards reopening and allowing people to be around each other again. But it's a little premature to do this sort of widespread. It would be unethical for us to recommend a test that we then don't know how to interpret.
Right. Makes perfect sense. Well, so much more to learn about all of this, and thank you for shedding some light on what we do and don't know on the subject of antibodies. Now, a lot of people are concerned about their wallets, and I think we've got a question here concerning monetary consequences. Is that right? Yes, this one looks to me like it belongs squarely to Roger.
I agree, Mike.
But when it comes to fines, I understand that there is a fine in the executive order. It's going to take quite a bit to get to the fine. First off, we're going to have, if you have a complaint, we have the Chamber of Commerce. Bill Christopher takes the lead. He goes out on the first time. He has a conversation with the individual, depending upon, let's say it's a retail owner who is responsible for making sure all the persons who come into their establishment that they're wearing a mask. And understand that it's the retail manager or the owner of the shop. It's not the person who's not wearing the mask. So to have a conversation, you need to have your customers mask. You can not serve them. However, if they have a reason, maybe they can't wear a mask, you would say, okay, you can't wear a mask, fine. But understand that it's the owner. Now, the second time out would be somebody from law enforcement with the same complaint. And have law enforcement would be the third complaint. I'd be the second. Law enforcement would be the third. And as we've stressed from the governor's office, from Maryland State Police, and our good friend who's a superintendent of state police, Jerry Jones, who's from Dorchester, it's about education. We don't want to fine anyone, but at the end of the day, if a person, manager of the store, cannot and will not comply, then ultimately it would be a state's attorney would be involved, and the officer would file charges against them. Ultimately, I think in the executive orders is it's a $5,000 fine. Fining is not what it's about. What we want to do is make sure we come in and we're in a safe place, because I read a comment about folks who might put you at risk if you're out shopping. Well, if you're wearing a face mask, if you're washing your hands, sanitizing them after you touch things in the store, if you're keeping social distancing, we're minimizing your risk. So therefore, that person and that other person is wearing a mask. As Dr. Scott said, we're not getting zero, but we're minimizing your risk when that person's out shopping with you in the store. So fines is not what it's about. It's about education. It's about the soft approach and making sure that we have a safe environment for people to shop and our store owners are able to stay in business. So let's talk. I like the fine is there, but that's the big stick, which we don't want to use.
Well, thank you for that. I like the way you're talking about using it to sort of prod people in the right direction, and then not only becomes a real monetary consequences as a matter of last result for abject non-compliance, I suppose.
Yep. Absolutely. Thank you.
Now, here's another one that looks like it should be for you, Roger, about ratting out our neighbors, I'll call it.
Well, first off, the way the question is worded, my first advice would be, you should, if you know who your neighbor is, I'd go over and have a conversation with them. Maybe you don't want to have a conversation. And if you don't want to have a conversation, you may report it. You may report it anonymously, because maybe there's something going on between the neighbors already. And we'll definitely take a look at that. I deal with anonymous complaints quite often, environmental health and tall grass in the summertime. So it's something we're used to. So we'd send somebody out to have a conversation with the homeowner. We'd like to see you resolve it as a neighbor to neighbor, but if that's not possible, feel free to make the call into to the appropriate authority on that particular case. It's a law enforcement. So if you call 911, they'll get the right law enforcement agency out to visit with you. And then I would follow up with some education if they wanted more education about why you shouldn't have more than 10 folks. Not only the 10 people, it's are they social distancing as well? Are they keeping 6 foot in between each other? So hopefully that'd still be just an education that we'd be making.
Right. Not a call to the police department.
No, we'd hope not. But.
Okay. We've got another one here. Let's see who this would belong to. Do we have the one about family members? I think I saw one come by on the screen here.
Yeah, I think we did see a question like that once upon a time. There it is.
Yeah, there we are.
There you go. Yeah.
That belongs to Dr. Scott, I'm sure.
Yeah, yes.
It does. So I'll tell a little anecdotal story. I have a 6-year-old daughter, and she turned 6 in April. And we had big plans. We were going to go to New York City and take her to see Frozen on Broadway. And, she'd never been before, stay in a high-rise hotel. And that was supposed to be the end of March. And about mid-March, we decided to cancel that because of COVID. And then it got canceled for us. And New York became a hotspot. And she ended up turning 6 with a virtual chat room with our family and friends. And I say all of that because that's the level of risk that we were willing to take at that time, right? So I think, we went from a stay-at-home order to a safer at-home order. And when we talk about the actions that we choose to take within the governor's orders, we're looking at risk levels. Okay. So there are going to be some people who, even as we open up, are not willing to accept a higher level of risk, and that's okay. So that might be people who decide to still remain at home just with the people that they live with, and they're doing contactless purchasing. They might be doing curbside pickup for their groceries or having someone else grocery shop for them. People who are willing to accept a slightly higher level of risk would be those who, want to do some outdoor recreation in a park where there's plenty of space between them and other people. And it's in an outdoor environment that's well ventilated. People who are willing to accept a little bit more risk are those who are willing to sort of be in groups of no more than 10, but in an open, well-ventilated environment. And then those who are willing to accept the most risk that we are allowed to take really at this point in time would be being in a group of no more than 10 people in an enclosed space. See, all of those actions are well within the governor's orders, but they all have a different level of risk. And I think it's going to be important to keep in mind that as we go through this process of reopening, people are going to feel comfortable or uncomfortable with different levels of risk, and that's okay. We need to be okay with that difference. And so there's not a great answer to this question. I think you have to really assess the level of risk that you're willing to take, the level of risk that your family members are willing to take. As long as you're operating within the governor's order, you're legal. But it's going to be an ongoing risk, what risk you're willing to accept. This is one of those gray areas where there's not a good best answer.
Yes, we're back here, and my microphone's on. Okay, we've had a number of questions come in from those that are online and watching, and in particular, there it is. We've got the one from the Hyatt here. I'll be happy to fill out the rest of it that didn't fit onto the screen, but maybe Dr. Scott, you could take a look at this one and begin to respond.
Okay, so for those who aren't, it's really asking, thank you, Joel, for your question.
Yes.
It's really asking about the different types of masks and sort of why we're wearing masks for this, and we don't necessarily recommend masks for like the flu. So I know there has been a changing dialogue about masks from the beginning. First, it was you don't need to wear a mask. And then it was everyone needs to wear a mask, but don't wear that mask, wear this mask. And now you have to wear a mask inside. So let me try to explain a little bit about that. So there are masks that are also called respirators, and those are N95s. I wish I had an example of one to show you, but those are the masks that healthcare providers and frontline responders wear to protect themselves from people who have COVID. So it helps protect the wearer from inhaling any of those respiratory droplets that are in the air or in close proximity to a patient. And that's why we've asked people from really the beginning to not hoard those, to not buy those just for common everyday use. Keep those for our first responders. And that's the PPE that we as a health department receive and distribute to those agencies. Then we get into face masks that there are surgical masks, and those usually like loop over the ears. They can be blue or white. They look pleated in the front. And then the cloth face masks, which could be a scarf or a gaiter or a bandana, anything that really covers, making sure we're covering the nose and the mouth. Those types of masks protect other people from you. So what we know about COVID-19 is that a lot of people can get it and not have any symptoms. So you could be COVID positive and not have a cough, no fever, no sore throat, no runny nose, no shortness of breath. But you're going to the grocery store, and every time you clear your throat or talk to your neighbor, respiratory droplets are coming out. So just the simple act of covering that, even if it's with a cloth mask, can help protect those droplets from getting into the environment. That's why it's important. And that's why now we're saying, yes, please do wear a mask, because we now understand that that risk exists in people who don't have symptoms. I hope that answers your question, Joel.
That's a pretty. Do we have another question from those that are watching online? Here we are. Which one of you would like to take that one? I'm not sure if it belongs to Roger on the enforcement side or to Dr. Scott talking about the wisdom of the risk.
Let's ask Dr. Scott to take the first piece of this, and then I can follow up.
Okay, so sort of in the pre-phase one, if you will, when the governor lifted a few restrictions, one of the things he lifted was outdoor fitness, right? So, or even with phase one. So outdoor fitness is allowed. It's, you know, if fitness is a part of your life and you've been missing it like I have, I encourage outdoor fitness. We would hope that people are maintaining their social distance as much as possible. It's not required to wear masks during outside fitness. That sort of outside space is thought to have pretty good ventilation. And also we don't want people to become overheated or to have shortness of breath while exercising because they're wearing a mask. But I would say, you know, in terms of how close they were, I would bring that up to the people at the Y and ask them, you know, can we make sure that we're really making sure people are 6 feet apart? Maybe that is chalking out boxes for people to have their bikes in, or really for me, it would also be making sure everyone's wiping their equipment down really well in between classes. But, you know, it's good to hear that people are getting back into it. And I think it's really just a question for who's setting that up to make sure that it is in the safest way possible.
Thanks. A little housekeeping note here that we had originally indicated that this would be just a 45-minute broadcast, but with the indulgence of Roger Harrell and Dr. Casey Scott, we've got so many questions in the queue here that we'd like to take just a few more. Let's
That's
see
fine.
what's up next.
Oh
yes.
Ooh.
Here we go.
So I'll take that one. I hope we have answered that, but yes, we now have the ability to do that. And that's not something we've been able to say for a long time throughout this because of the lack of test kits and the ability of our lab to put those tests through in any sort of reasonable amount of time. But we've reached that. This is a new benchmark that we're at. And so, yes, we we can, we will. You may see that, that might be a slower uptake in terms of the different primary care providers being able to offer that, because maybe they're waiting on additional test kits to come in. But this is one of the good things about the Walmart testing. I saw a question in the feed. We might not get to it, but I'll address it here. It's going to be outside, so people who are going who might have symptoms are not going to be coming into the store. It's going to be like a drive-through sort of testing. But this is going to allow the opportunity to get a better idea of how many people actually are positive at that one time. And so our health department testing, when we expand that, will also be available to people without symptoms.
Well, it sounds like that will greatly help to figure out exactly what's going on in the community with this. So many people supposedly have not had symptoms, but did ultimately show up with the test. So here's a question from our mayor, I believe. Who would like to take this one?
Yeah, I'll start it, Casey, and then let you follow up. This scenario that Mayor Stanton is pointing out, we do hear quite often. But understand, if a person is positive, we get the report at the health department. And then I have a contact tracing staff that calls that individual. And the individual, we ask them certain questions, and who were you close to? Who'd you have contact with, et cetera, et cetera. To make a long story short, if the individual you're talking about did not tell us, we have no way, I wouldn't answer the question the way it's posed, because we need to know from the person who's positive, who were you in close contact with? It's a confidential process. And oftentimes we will have somebody call in and say, I was close to XYZ person, but what should I do? Well, the important thing is if you go back to that person and say, you need to let the health department know, and let the screeners call you, the folks that have the expertise. And I'm going to throw this to Casey to tell you what the expertise is to determine whether or not you should shelter in place. So Casey, I'll throw it over to you for that expertise.
Yeah, Roger, I totally agree. So I think one of the take-home points here is if you or someone you know has tested positive and you get a call from the health department, one, you're going to be getting a call from us every day during your isolation period. So get used to it. And two, please be honest with us about where you've been. We're not there to interrogate you. We're not being nosy. We're just trying to assess risk. That's our job. And that's really it's important to everyone on the team to make sure that we know the risk, and then we can then tell the people who might be at risk what to do next. So yeah, we ask about the type of contact that you might have had. If you were just in a room with someone who tested positive, but you were more than 6 feet away, that does not count as close contact, okay? So not every casual interaction puts someone at the same level of risk as if I tested positive and my husband is a contact. He's definitely at risk because we live in the same household. So we go through that list of questions to determine who's really at risk. And then we play this game of making sure that we assess that risk appropriately while also trying to maintain the privacy and dignity of that individual. We don't want people to be discriminated against because they have COVID. It's certainly no one's fault when they get COVID, but we also need to relay risk to the community as a whole if that's necessary. So I know there's been a lot of questions like, oh, can you tell us if that person went to Walmart or if that person went to Food Lion? If they went, and told us about people that they had close contact with, those people would be notified. But a simple casual interaction that's less than 10 minutes or so does not infer risk. That being said, Mayor Stanley, if anybody is concerned and wants to be tested, we now have this opportunity to do so.
Yeah, absolutely.
What about the situation along those lines where you've not only been in the same room as friends, but it's quite common to hug friends and shake hands, say hello, and say goodbye when you saw them. Does that elevated physical contact put it into a different category, or is that just a big question mark?
So it certainly does. I mean, I think that's one of the things that I've missed the most in this whole thing is seeing friends and giving them hugs. I'm a hugger, and I haven't hugged my friends since March. So again, I think it's one of those things. It's this risk that people are willing or not willing to take. Every close contact, so close contact defined as within 6 feet, puts you at more risk. Obviously, the longer that close contact, the higher the risk. The more frequent that close contact, the higher the risk. So, one of the things you can think about is if you do end up testing positive and the health department calls you, and then we have to ask you, well, who have you been around? Where have you been? Be proud of what you end up saying, right? We want to make sure that people are following the rules and trying to limit their risk. We realize that this is really hard. This is hard for everyone involved. And we know we can't live in this stay-at-home state forever. And we're doing what we can to make the risk the lowest for people as we start to open up business and recreation.
Yeah, I guess the worst thing that could happen to us is we do pretty good like we've been doing, and then have a spike, and there's a boomerang effect on the regulations and all. So here's one that looks to me like maybe this belongs to Roger.
Yeah. Well, it's not an issue of why it's not safe. It's an issue with the governor's order has restaurants still and bars still closed. That's as much as I can say at this point. That's a governor's order, and it still maintains today. And I understand the frustration. We had the same frustration when the superintendent of schools and state's attorney Bill Jones and we were discussing about why we couldn't have the graduation. And you look at every day at the Walmart parking lot, it's full. People are inside. They're practicing social distancing. They're wearing face masks, but the issues come down to what is the law, and the governor has said that restaurants and bars are still closed, and so therefore we're obligated locally. We cannot do anything less stringent than what the governor has in his order, i.e. if we allowed you to have even outside dining, that's less stringent. That's not consistent with what the current law is. We can be more stringent, but not less. So I feel I feel for my local businesses and my restaurant, any owner, restaurant owners in particular right now, because that's a tough business. And it's tough to make it when you in a regular time, much less when you open up, and we're going to have to minimize how many folks you can have in your restaurant with seats. So I sympathize with you, but the governor's order is the restaurants are still closed, so therefore outside dining is closed. So I would hope it would change before this weekend, but it doesn't look like it's happening.
Okay, well, maybe that will be one of the next up recommendations for a little further relaxation. The same that we saw with fishing. Initially, it was only if you're going to be eating it for tonight's meal, right?
Our running joke was you need to have the fishing pole and the license when you went out on the boat. You're covered.
Right. So here's another one here. Okay, so I guess this one goes to Dr. Scott.
I'll take this one. So it is not important for the general public when you're going into retail establishments to necessarily have a face shield. That is really most important for first responders and healthcare providers. If you're going out into public, you're picking up groceries, you're going to get some ice cream from downtown, a simple cloth face mask is just fine. Just make sure that it's covering the nose and the mouth. We see a lot of people who wearing masks are uncomfortable. No one likes it. But it's not effective if it's down here or if it's down here. It really needs to cover the areas in which you breathe.
Mm-hmm.
Okay, got it. Do we have another question? Yeah, here we go.
Oh, that's a good question.
Right. Is that one belong to you, Roger?
Well, I could go to Casey or me, but either one. Yes, there will be testing in Hurlock. We don't know exactly when, but we'll be doing, we're going to spread around the county. Now that we have enough test kits, we requested some more today. And what was very frustrating was that when we were testing all the employees at Amick Farms, which is up in Hurlock, we weren't doing community testing. Now, the rate of positives up in Hurlock is not as great as it is in some other parts of the county. But we want to make sure, and we talked this afternoon in our team meeting, that as we roll out our testing, we don't have a date yet. We will be up in Hurlock testing.
Okay, well, that's good news. When you say Dorchester County Health Department, that proves that you're at all parts of the county. More questions from the group. Here we go.
Oh, I can take this one, Mike.
Sure.
So you're absolutely right. As we expand testing, our case counts are going to go up. So it's like when you look for it, you will find it. And so, like, for instance, I think Maryland had its highest increase in cases yesterday. We had over 1,700 new cases in one day. That does not necessarily mean that it is spreading like wildfire any more than it was last week. But you're right. So one of the things the governor is focusing on is there's two metrics, and you can find these on the coronavirus.maryland.gov website. They update it once daily. Number one is our hospital admission rate. So that's looking at how much we are using the hospital for COVID-related illness. And number two is ICU admissions. That's people who need to get admitted to the intensive care unit because they have difficulty breathing, they need to be on a ventilator, they need extra special care. Okay, so we're looking at those two numbers to really plateau. And so when he initiated phase one, those numbers have been stable for about 2 weeks, and that's why he felt comfortable going into phase one. Now, it's important to remember, he and his task force are continuing to look at these numbers. So, we have the next couple of weeks while we're in phase one to hopefully keep those numbers the same. And if they remain the same, then they're given more confidence that we might be able to move into phase two. If those numbers go up at all, if we start to use more hospital beds for COVID, or especially more ICU beds for COVID, then that's not flattening the curve, which is what all this was intended to do. And the difference between that is, we wanted to flatten the curve, meaning we don't want to have this really tall peak of cases. We wanted to keep it kind of low and down, which means it's going to be leveled out for longer, but that's allowing our hospitals to not be extremely overwhelmed by the number of cases. And so if we're able to do that, and I think we will do that if we kind of all work together and do this, awkward social distancing, wearing face masks, washing hands kind of thing, if we can keep that up, we're going to keep moving towards reopening. And I'm very confident that we here in Dorchester County will be able to keep that up. I'm hopeful.
Well, we've certainly been doing great based on the numbers here for just the last few days. I don't want to get ahead of ourselves or anything, but you must be feeling good about the fact that it looks like the community is really doing all the right things and it's showing up in decent numbers lately. Here's one about mail coming into the house.
I can take this one.
Yeah.
So just like with any other, commonly touched surface, we're asking people to really clean hands. And anytime you're touching something that's coming from outside of your house and you're bringing it in, once you're done handling it, to wash your hands well. Postal workers, I'm not exactly sure what their process is for determining, if they're doing screening, and I'm sure that's set on sort of a federal level because it's a federal agency. But, in general, you're not having direct contact with your postal worker, which would be the highest risk of transmission. It would be, that touch of your mail, which then sits in your mailbox for X amount of time, which then lowers the risk. And then by the time you bring it in general, we don't think mail is a very common way of getting COVID-19. But again, if you wanted to be extra cautious, when you bring your mail in, throw away the mail that is junk mail right away. Open up your envelopes, throw those out, keep everything else you need, and then wash your hands well.
Okay. All right. Really good to know. And here we are. Here's one about going to the dentist. This one definitely sounds like belongs to Dr. Scott.
Will dentists be able to test patients? That's a good question. So, the governor just expanded the ability for pharmacists to test, to do the ordering of patients. I have not heard about dental offices being able to test patients. I haven't been to the dentist since everything closed. My kids have had dental appointments canceled, and then now we're trying to reschedule. And I know a lot of dental offices are really taking this very seriously, and they're doing a lot of sort of standard precautions. So they're screening all patients before they are allowed to come into the building. They're having you wait in your car and bringing you directly back to the exam room. They're having you wear a mask until you do your actual procedure. Obviously, they're wearing masks during the procedure, which they do always anyway. But yeah, I have not actually heard anything specific about dental offices being able to test. And I don't know how useful that would be, since the test does take several days to come back. But as testing expands more and more, maybe that's something coming down the pike. I'm not sure.
All right. Well, we are out of time for this hour. I don't know where all the time went, but it certainly went quickly. And I think that's really thanks for the great efforts of Roger Harrell and Dr. Scott here. Roger, did you want to add any closing comments for us?
Just the one in terms of metrics and in terms of testing. Casey covered it very well on the question about flattening the curve and the metrics that the governor is using there. The other metric he's using is that we're statewide, we were doing about 8,000 tests per day. He wants to get up to 10,000. And the key to that is, and the reason we want to do more testing, we want to know the prevalence. And if somebody's tested positive, we want to be able to isolate them and isolate their contacts. And that way we can begin to control what is happening in the community versus having to go back to totally shut down where we have to stay at home. So for us to get ahead of the curve, you may have heard in the reports that they wanted to hire X number of contact tracers. And the estimate is that you need one for every, for the numbers. We have to have 10 contract testers now because we have 32,000 population, so you need one for every 3,000 plus population. So we're prepared to do that, and that's going to help us as we look at the other numbers as well, as Dr. Scott was talking about. And one last thing, I would want to assure the community that our healthcare delivery system here has the capacity with ventilators, with the ICU beds, and the capability to take care of the community. With us flattening the curve, it should get better, but I see that on a daily basis, and that's another key element to make sure that we can begin to open up businesses more. So just in closing, thank the sponsors. Thank you for this opportunity to come face to face with our community and share. And there's more to share. Reach out to us. We can talk about some other studies and some good things as to why we do certain things, especially with the churches these days. They have some concerns.
Dr. Scott, any final comment from you?
I just want to say thank you to our citizens. Thanks for your questions. Thanks for your concerns. The conversation certainly doesn't stop here. We are here for you. Our job is to help protect you and help you stay informed. We have, like I said, a website, dorchesterhealth.org. We have a Facebook page, Dorchester County Health Department Emergency Preparedness. And then we have our phone number, 410-228-3223 during normal business hours. Reach out, please. We're here to make sure you have the right information.
Well, you've certainly done a great job of that tonight. And on behalf of the community and the sponsors, we're so fortunate that we have the two of you in such a professionally run health department here in Dorchester County. We're really pretty fortunate. It makes it a great place to be, as we like to say. So thanks to the community, the Cambridge Association of Neighborhoods and the Dorchester Banner, and of course our friends here at Cambridge Community Radio. We really appreciate everyone tuning in for tonight's broadcast, and look forward to hopefully seeing you back here next week with another Cambridge Community Conversation. That one will be about the Board of Education runoff that's coming up the following Tuesday. So for tonight, stay safe and good evening.
Well, wash your hands.